What is the treatment of rheumatism of joints? Contents: 1. Rheumatology of joints. 2. Treatment of rheumatism of joints. A. Pharmacological treatment. B. Surgical treatment. C. Home treatment. 3. Symptoms of rheumatism of joints. 4. Risk factors for joint rheumatism. Rheumatism of joints. The immune system in the human body contains a number of antibodies and defense cells responsible for fighting foreign bodies and infections that attack the body, but in cases of autoimmune diseases, the immune system incorrectly targets the body's own tissues and deals with them as a threat that exposes the body to danger. It begins to release antibodies and immune cells to attack them, which leads to inflammation. Rheumatoid arthritis, or rheumatism of the joints, is one of the autoimmune diseases that results in chronic inflammation in the joints and the surrounding tissue, and inflammation and damage may affect other body organs as well. The effect of rheumatism in the joints usually begins in the joints of the feet and hands, except it may also affect any joint in the body. Rheumatism treatment of joints. Drug therapy. Here is no actual treatment that can completely cure rheumatism of the joints, but there are many drug treatments that can be used to alleviate the symptoms of the problem as much as possible, and among these drug options are the following. Disease-modifying anti-rheumatic drugs. These drugs help reduce the immune response in the body, and thus contribute to slowing the progression of the disease, examples of which are sulfasalazine, leflunomide, and hydroxychloroquine. Non-steroidal anti-inflammatory drugs, which help relieve inflammation and pain in mild and moderate cases of rheumatism in the joints. Examples include ibuprofen, naproxen, and other strong-acting NSAIDs that are released by prescription. Biologic response modifiers. It is a new class of disease-modifying anti-rheumatic drugs that differ from the previous generation in that they target specific components of the immune system, examples of which are etanercept, abatacept, and infliximab. Corticosteroid drugs. These drugs help relieve inflammation and pain for a short period of time, such as prednisone. Surgical treatment. The doctor recommends surgery in case of rheumatism of the joints if medication and physical therapy do not help, with the aim of relieving pain, correcting the deformity, and repairing the damaged joint. And among the surgical options that can be resorted to in the case of joint rheumatism, the following can be mentioned. Tendon repair. Surgery can repair the tendon surrounding the injured joint if it has torn or loosened. Arthrodesis. The surgeon uses a bone or joint fusion in order to stabilize the joint and relieve pain. Arthroplasty. A surgery in which the doctor removes the damaged parts of the joint, and installs an artificial joint, or a plastic or metal graft. Synovial resection, synovectomy, in which the synovial membrane is removed if it becomes infected and causes pain to the patient. Home treatment. Several methods and home tips can be followed to improve quality of life in case of joint rheumatism, including the following. 1. Resorting to heat or cold therapy, or alternating between them. Using warm compresses or bathing in warm water helps relieve stiffness in the joint, while using ice packs and applying them to the affected joint can help reduce pain and inflammation. 2. Doing light exercises, as it may contribute to improving the range of motion of the affected joint, and yoga exercises can help restore flexibility and strength. 3. The use of assistive devices, such as braces and splints that help to stabilize the joint. It can help reduce inflammation in the joint. 4. Getting adequate rest when rheumatic symptoms appear. Good sleep may help reduce inflammation, fatigue, and pain. 5. Eat certain types of foods that may be recommended by a doctor or a dietitian, which have anti-inflammatory properties, such as high-fiber foods, such as vegetables, fresh fruits, and whole grains. Foods high in omega-3 fatty acids, such as chia seeds, fatty fish, and nuts. Foods rich in antioxidants, such as spinach, berries, and dark chocolate. Foods that contain flavonoids, such as green tea, grapes, and soy products. Symptoms of rheumatism of the joints. The symptoms of rheumatism of the joints appear during certain periods, and disappear in other periods, and this period in which the activity of the disease increases, and which extends to days or months, is called the flare period, and as follows some of these symptoms are mentioned. Loss of appetite. Feeling of joint stiffness in the morning, which continues for half an hour or more after waking up. The same type of joint affected by inflammation on both sides of the body. More than one joint in the body is exposed to infection. Suffering from fatigue. Suffering from pain, swelling, or stiffness in the affected joint, and this problem persists for a period of up to 6 weeks or more. Have a slight fever. Small joints in the hands and feet can be affected by inflammation and swelling. There are many factors that may increase the risk of developing joint rheumatism, including the following. Smoking. It is possible that the risk of developing rheumatism in the joints increases as a result of smoking, especially if there is a genetic predisposition to developing this disease. Genetic factor. The presence of a family member with joint rheumatism increases the chance of developing it. Age. Rheumatoid arthritis is most common in individuals between the ages of 40 to 60 years, although it affects people of all ages. Obesity. The risk of developing joint rheumatism increases in the case of overweight or obesity, especially among women who are 55 years or younger. Gender. Rheumatism of the joints is more common among women than men.